I had been laying face down for a minute, breathing literally as hard as I could, and we had just won our age group. But at what cost? That was my first injury. Kind of a weird one to start on, but definitely not the worst. And that explains why I'm wearing this actually. Just came from the last event. And that one's a doozy. So let's start from the top. The beauty is because I'm a rehab physician and metabolic medicine as well, I can look back at these injuries and teach you how to avoid them at all costs. So let's go through everything in sequential order, because this way you can kind of live through them as I did. The backstory. My name is Dr. Alice Watson, and I get people ready. First, I'd really appreciate if you could just give it a little like and help other people find this information of getting people ready for cancer therapies, surgeries, the whole prehabilitation gamut here. In this case, I want to get myself ready, and actually my sister, for some of these competing in different performance-based events. We decided to make a little Middletown, Delaware Triple Crown. Hope that doesn't get copyright flagged or anything. Or, yeah, whatever. Those events were a DEKA Strong, hosted by our good friends at Dun Dun Fitness. The 9K, not running the marathon, that's ridiculous, down at Rehoboth Beach. And then today, we had a powerlifting competition over at Barbell Brothers Gym for their inaugural event on their 1-year anniversary. Props to them on that one as well. So, the idea was, being that I know how to train people, because I'm generally in pretty good shape, and lean towards the lift heavy stuff fairly safely, I thought, all right, let's prove our chops here, get ourselves ready for these events, and see how well we can do with the least amount of training while also cross-training as hybrid athletes. So, these events were about a month apart. The 9K was actually about 3 weeks ago. And I wanted to end on what I thought was going to be my best event. So it was a true powerlifting meet hosted by USPC. They're one of the newer powerlifting associations. And originally, I was entering it just to do the deadlift. Maybe I should have stuck with that. And bench, just because, you know, decent pecs, whatever. At the last minute, I said, well, if I'm doing the two of them, I do kind of want to get a true, you know, total of all three, aim for maybe that 1,000-pound club, and see how well we can do it. So, starting from the top, that first event was the DEKA Strong. So for anybody unfamiliar, here are a few clips of that one.
Yes, good job.
So, as you can see, it's not particularly intense at each individual station, but when you string them together, it is the most VO2 max, aerobic intensity demanding thing I've ever done. And here you can see my reaction to it. My little sister was carrying my butt, not literally, although actually probably would have needed it at that point too, as we end up taking first in our age group and third, fourth overall. But I say that with confusion because the first, second, and third spots were taken by Stacy and Ken, two nationally ranked DEKA participants here who were on the first team together, and then each one was on the second and third team. So not that I'm giving myself an asterisk here, but they're phenomenal athletes, and I'm proud to have lost to them, so that's okay with me. That was a 3-week training period, and with our arrogance, we said, come on, how hard can it be? So, that first injury. When I was laying on the ground for about 10 to 15 minutes in what was late February, early March, a nice cold Saturday, I believe it was like 30 degrees outside, and it felt so refreshing. I was breathing so heavily, it actually triggered a condition called neurogenic rhinitis. All that really means is you got a runny nose and all that, and sneezing, everything from a neurogenic cause. So instead of the usual allergic rhinitis that's going to be histamine-based reaction, some allergen trigger that, instead it was I breathed so hard I angered a nerve in my sinuses and could not stop sneezing for about a week. I prescribed myself steroids at that point, thinking that I had just inhaled a ton of pollen in the gym, and it didn't go away. Until finally I did a little homework and learned from the condition, and ended up instead getting a nasal spray that is kind of specially preferred for this, and it went away nearly immediately. So diagnostic and therapeutic. So injury number 1. How could I have avoided that one? And how can you learn from this? Train appropriately. While I did train for the actual events, which is useful, what I really should have done was just do whatever I could to improve my VO2 max, which in this case would have been high intensity interval training. I kind of did that, but a week of that 3 weeks was also lost to my son having brought home a nice virus from daycare. I think it was RSV, which had affected me so much that during my 3rd week of training, so it's like 4 days before the event, I was dry heaving in the bathroom with my fingers turning purple. So at that point, I should have known I was in less than ideal shape for this one, but I'd committed. Injury number 1. Okay, number 2. So this kind of feels like that last situation where my fingers are purple and all that stuff, because my fingers turn purple again. In this case, that was because I had immediately shifted from DEKA training. I believe it was like the Monday after DEKA. I said, all right, cool. Now I get to go back to training for the stuff I really enjoy. Because my favorite way of lifting is lift heavy, compound movements. It's the fountain of youth in most situations, except you do need some aerobic training there too. I'm gonna take that one with me from now on. So in this case, I went from my baseline kind of maintenance training is going to be a lot of pull-ups, a lot of deadlifts, some squats, shoulder press, and dumbbell press for chest. I never really did barbell flat bench just because back in the day I injured my shoulder, not understanding how rotator cuffs work, proper form, all that stuff, and instead was doing the things that had you a little more mobility. So when I started training for the dual 9K and powerlifting competition, I said, okay, why don't we essentially do 3 days a week of powerlifting training and then 2 or 3 days a week of dedicated aerobic training, and then on some of the powerlifting days, maybe do some light zone 2 at a different time of the day. So zone 2 training, I've talked about this before, and I'm going to steal this from Peter Attia because that's where I learned it and got really into it. Inigo Samalan is another very well-known individual for his zone 2 advocacy. But in this case, it's a great way to get a nice aerobic base, and everything else can build on top of that. So in this case, it was going to give me the chance to just gradually improve my aerobic conditioning without negatively affecting my gains on the powerlifting side. So if you're running kind of long distance and at a higher intensity, there is a little bit of mutual exclusivity or zero sum to that plus powerlifting gains or even hypertrophy, so muscle size gains. But zone 2 can mix it well. So I was able to do a little bit of a hybrid training, which is probably what I'm sticking with from now on. But I didn't want to waste any gym time on anything that was not going to be in the powerlifting competition. So in this case, I basically did a chest day, a pull day, so it's going to be deadlifts and then some rows, and then a not chest day twice, and then a squat day. So kind of a leg pressing day. So it's going to be squats and then maybe a little shoulder press just to balance things out. The problem was I really enthusiastically jumped to the chest day because I had, since I gave up flat bench, had been through med school, residency training. I trained with some of the physicians who were on the United States Olympic team and treated a lot of the Pittsburgh professional athletes. And so because of that, I was like, I know what I'm doing now. I can avoid hurting my supraspinatus, part of the rotator cuff. So got really excited about doing chest day for the first time in years. And within about 3 days of that Monday, started having kind of aching in the left side of my pec. This ties into a couple of the injuries all at once. So in doing that, I took it easy, started stretching it out, finding ways to do that. It just never got better. So I was doing eccentric training. So I was trying to do a lot of weights on the eccentric phase. That's a good way of kind of rehabbing muscle strains if you do them appropriately. Isometrics are better really in this case, especially when there's an acute injury like that, because it'll be a little gentler. Wasn't getting better. As it turns out, with all of that pressing, and undertraining of all the scapular stabilizing muscles. So your shoulder blade requires a lot of stabilization because everything attaches to it. So if you don't appropriately train your serratus muscles, those are the ones that play ribs on ribs right here. They actually connect to the underside of your scapula and hold it against the back of your rib cage when you're doing pressing movements. If you don't train your trapezius muscles correctly, they're the ones who help it swing correctly and also kind of keep it fixed to your rib cage as well in certain planes of movement. When I was undertraining those, it caused my pec minor, so the muscle underneath your pec major, like connects to the coracoid process right around here and your ribs here, to pull it down. So in the same way that we all kind of have this internally rotated shoulder aspect because we're all on our computers all day, by doing that, it essentially caused its self-perpetuating issue. Really tight pec minor caused pec minor pain. It also kind of caused, bidirectionally affected the serratus muscle. So due to undertraining of that, I started actually getting scapular winging. So my shoulder blade was coming off a little bit, and of course I was like shocked by this. I've seen it a million times in residency and training and everything, but never really thought it would happen because I thought I was a pretty well balanced athlete with resistance training. You live and learn. Back to the blue fingers. Okay, so the problem with that, there's kind of a pec minor type syndrome here, where because of the tightness of that compression, it can actually cause a thoracic outlet syndrome. So it's kind of an acquired thoracic outlet syndrome. So you may have heard about this or seen this, but it is, there's the real cause of it is all the major arteries coming out of your thoracic area going into your arms, the outlet, someone could say, that can get compressed. And so in this case, when I was running and kind of doing this motion, have this tight pec minor that is compressing the axillary artery going into my arm here, and I was getting blue fingertips. So that was injury number 2. Really kind of a couple tied in together. So the pec strain, is the pec minor strain, the thoracic outlet syndrome from that, and the scapular winging. So what I learned from that one I learned that anytime you're doing a lot of heavy pressing training, so heavy bench, heavy shoulder press, things like that, I mean, really in general, it's just a good idea to have some time dedicated to control of the really unstable joints. Pretty much the most unstable aspect of our bodies is going to be our shoulder blade and where the arm bone connects to the shoulder joint here. That's the glenohumeral joint. So that is one of the least stable joints in the body. And then on top of that, it's not really a joint so much, but effectively how your shoulder blade sits on the your rib cage here behaves kind of joint-like because it is controlled by a lot of dynamic stabilizers. And dynamic stabilizers are just tendons and muscles and things like that, whereas the static stabilizers, as we call them, are going to be ligaments. Just shorthand here, tendons connect muscle to bone, ligaments connect bone to bone. Lower extremity injuries. Okay, so even though I'm built like the Kool-Aid man, I do have a little bit of leg strength here, and the whole reason I entered the powerlifting competition was because I love deadlifting. The irony you'll see at the end is heartbreaking. So, there are a couple kind of related injuries again here because they kind of come in sets. My strategy going into the powerlifting competition was going to be lean on my best performance exercise here. We Watsons have gorilla length arms and are built for deadlifting, not bench, not squat as much either. We always joke that we can scratch our shins without bending over, which just makes it very easy to pick things off the ground, like the deadlift. So I had already started a good point with that one, but I knew if I can juice that one up a little better, then I'd be able to bring my total number up much more easily, but with some dedicated training could also bring up my lagging elements pretty well too. So I was working on my deadlifting and said, all right, I'm going to mirror the requirements of the competition. So no wrist straps. I never really use them anyway, just because if I can't pick it up without my bare hands, I shouldn't be picking it up, safety-wise. So when you're grabbing something on the deadlift here, when you get heavy enough, I like to start with a dual overhand grip. So, pardon the singlet. Injury. So when you're doing the deadlift, dual overhand grip, and you're gonna pick it up, pick it up here, and lock out this way. Okay. Jeez. But there's a certain point when it gets so heavy that doing the dual overhand grip, it's gonna roll a little bit in your fingers. So you do an alternating grip. It's a great way to have, if it's gonna roll, they're gonna cancel each other out. Doing that enough times creates a few problems. So back to the pec minor, when your overhand grip this way, that is an internally rotated shoulder, pec minor tightness again. So I was doing a lot of this way, which actually worked pretty well for both arms. But I didn't want to overtrain one direction because then you may have weird imbalances and stuff. So I would, switch this way, right hand underhand. Well, picture the force in your hand. When you're holding a weight really heavy like this and it's a deadlift and you're starting to pull it up off the ground, your hand is creating stability because your pronator muscles are essentially pronating against that bar, and it's helping your grip. At the same time, all your wrist flexors and extensors are co-contracting to keep the stability. A lot of jargon there, but the whole point is essentially all the forearm muscles are fighting at once, contracting as hard as they can to keep that bar stable. So by doing that, you end up creating that really strong grip I prided myself with. Build it with pull-ups, weighted pull-ups, deadlifts, all that fun stuff. So enough of that. With this way, that's also a contributor to the pec minor strain. Didn't realize that my deadlifts were giving me pec pain. And this area is, when you have pain here, it's called golfer's elbow. I'm not much of a golfer. It's also caused by anything that's going to cause inflammation in the tendons that connect here, which are your pronator teres and all the finger flexors and the wrist flexors. So everything involved here in the deadlift. I've had this problem for years, but it flared up like crazy during my training here. Similarly, you got pain right here. Posterior tibialis tendon. It runs underneath the inside of your ankle bone, connects around here, and connects right to this part of your foot. By connecting there, it turns your foot inwards, so it essentially can supinate your foot. But if you picture where your foot's flat on the ground and you're doing this way, when are you doing that kind of motion? When you're picking something really heavy off the ground, this way, your feet are anchored by that supination motion, so the outside of your foot is digging into the ground, keeping you stable. Deadlifting is killing my body. So that got flared up too, especially when I'm also running several times a week. And I got new flat shoes for DEKA because it was actually really good for all the rowing and stuff. However, those flat shoes had a really rigid sole. And when I was doing my zone 2, when I was doing my zone 2 on the treadmill, God, I can't tell you about this one. The rigid sole made it so that I flared up that posterior tibialis tendonitis again. So, lessons from this one. All right, number 1, offload sooner. The deadlift hard part is, it's the grip, but it's also coordinating everything from your traps down to your feet. So I could deload a little bit from my elbow by instead using wrist wraps to give me a better grip on the bar and take the pain off my elbow. Start doing that. That's one thing that helped me get better. 2, for the ankle, this is where a different kind of strategy came in for both of them. Keith Barr is a researcher out of UC Davis in Northern California, and his whole shtick is strengthening tendons and kind of ligaments and all the structures in the musculoskeletal system by using isometric holds and sandwiching those holds with collagen therapy. Now, he was on Tim Ferriss a couple weeks ago, coincidentally, right when I was dealing with these flare-ups. So I was listening to this one, was actually going to the gym, and light bulb moments, realized that I need to bring that back. So I bought a big bag of collagen off of Amazon and started scooping that stuff all day. Because when you're taking a protein supplement by itself, general whey protein, it's got a lot of the really important amino acids you need for muscle growth. But collagen is a lot of other ones like proline and glycine and then some derivatives of those. So essentially what those amino acids do is they cross-link together and get this nice stretchability essentially. If you're taking whey protein and then do some of this isometric hold training, you're actually kind of in a deficit because your body doesn't have a ton of that extra, those core amino acids that go into collagen. And so it kind of soaks up the level. You get a little dip in your levels, in fact, not even a spike. So instead, I started putting these collagen supplements in my morning drink, and then I'd be sitting at my desk doing an isometric hold of this way. So essentially opposing all the movements of those muscles that connect to the elbow here. So pronation, wrist flexion, finger flexion. So I'd press down here and pretend that I was going to do this movement and just hold that for 30 seconds and then rest. 30 seconds, rest. But I did that as well as a nice hold in a crouch position and deliberately kept my foot pressed into the ground. That also healed my PT tendonitis too. So all that got better. Huzzah. So the lesson there, it's actually pretty easy to work on tendonitis, and the sooner you address it, the better. Because once it hits that subacute chronic phase going on, beyond like a couple months, it's a lot harder to wind that one back. And these were actually old injuries that kept flaring up. So getting to those isometric holds early, you want to make sure a couple things. They're overcoming isometrics, so you're not going into an eccentric phase and then holding it. You want to be essentially in a concentric phase. So a really good example of one that I'm going to go into later, or another injury, was on the last part of deadlift. So essentially picking up a bar off a rack to stand up a little taller. That's a nice overcoming isometric for your spinal erector muscles, and holding that for 15 seconds for a fresh injury, 30 seconds for a little more subacute chronic injury. This place is definitely haunted. Never been here like this. Can help recover that faster. The other piece of it too, and this is going to be a recurring theme from here on out in this episode, is sleep and recovery and stress management. So I'm in my office on a Saturday because I work a lot right now as we're getting a few things in the business launched, cleaned up, and shifted. So we're working a lot more on this kind of content because I really want to be able to kind of affect creator change, and I like writing, and we have the books we want to talk about and all that stuff. So this is a great way to get that out there and do a little teaching that I like to do on a larger scale. But all that work involves less and less sleep, and when I do sleep, I just have really bad insomnia, probably from caffeine. We will do a whole different episode on sleep issues, but that's likely where a lot of this came from. So lesson in this one, address it early. Isometric holds are wonderful, and also really manage your load carefully. Deload when you can, prioritize what's important. So again, back to the grip thing, the sooner I'd use those wrist straps, the better it would have been. The sooner I got the appropriate footwear, the better that would have been, yada, yada, yada. All right, next injury. This one doesn't really have a whole good lesson to it. I fell down the stairs in the gym, so I sprained the crap out of my ankle. Actually, no, there's a good lesson to this one for the recovery part. The injury prevention part of it is don't text while walking down the stairs, no matter how familiar with the stairs you are. Basically, it was a Sunday, 2 weeks before the race, and it was Saturday, and I was looking up like the weather or something ridiculous, and thought it was the last step, went to take a step, there was one more, didn't know about it, and in front of everybody, my metal water bottle hit the ground right at the same time I did to alert the world, grown-ass man on the ground here. So the recovery part of this was important too, though. This goes back to why we don't do rice anymore. kind of along the same lines as the isometric holds here, which is actually one thing I use to recover. And I'm going to use after today's debacle. So here's the deal. We used to, whenever you had any sort of strain, sprain, injury, whatever, rest, ice, compression, elevation. What you're doing there is you are avoiding re-injury, you're taking the pain and the swelling down, all that stuff. It sounds like a great idea. Well, even without seeing the research on that directly, we know that you don't want to use any sort of anti-inflammatories, ice baths, whatever, after a workout, because you reduce the efficacy of the workout. Why? Your body uses inflammation to know where to send healing factors and stuff. You probably see where I'm getting with this one. Well, after a sprain or a strain, if you rest it, ice it, all you're doing is setting yourself up for a subacute or chronic injury. The reason being, if you don't put a stress on something, here's where the isometric holds are actually working. By putting a little bit of a stimulus across that injured structure that involves a lot of collagen, your body is like, oh, the fibers run this way. Okay. So when it takes that collagen, it can lay them down in parallel the correct way, and this way they're all oriented together and it can recover faster. If you rest it and ice it, you're removing the stimulus, so your body sees the injured mess and says, I don't know which way these fibers are supposed to run, so here. And as my professor in med school would say, it looks like boiled spaghetti. There's no orientation. They just kind of sit there in this really, really inefficient, structurally unsound mess. Problem number one. Two, when you decrease inflammation, your body doesn't even know really where to do that very well. And so it doesn't even have a robust healing response. So for the ankle sprain, I was back to walking on a treadmill in a day. After doing isometric holds that afternoon and the next morning, I felt okay enough in this plane, so pushing off, as long as I knew I wasn't going to roll my ankle, so treadmill, not real world, steadily. By the second day, I was loading it heavily with squats. Again, not running, not any sort of dynamic movement. I wasn't doing lunges, bending down, standing up with heavy weight on my back. And the reason why is that when you're, let's try this again. So when you're standing on your ankle like this, you have all those ligaments out here preventing you from rolling inwards. Those ligaments include the ATFL, which we learned the mnemonic of ATF stands for always tears first, because that is the one that holds the most outside structure of the ankle there, stability. By loading those appropriately and not icing or elevating it, I was providing the stimulus of which way to heal. By midweek, I didn't even notice there was pain at all. All better. So I recovered from that well, was able to move on, still ran the 9K in about 2 weeks from there, and picked up the next injury. So, picture the skeleton. Actually, you know what? I'm going to show it on the screen now. Good. If you look at the pelvis and your rib cage up here, your lumbar spine's here, you have a muscle that connects the top part of the pelvis here, the iliac crest, to the 12th rib area. That muscle is called the quadratus lumborum. It is lumborum because it's near the lumbar spine. It is quadratus because it is rectangular shaped. Square shaped? It doesn't matter. Now, what that does in this case is it essentially functions like your gluteus medius. So when you see people doing those kickbacks in the gym, what they're doing is they're working the muscle that originates underneath the glute max, the big part of the butt muscle there, connects to the outside of your thigh bone, at the very top where you can feel the hip bone essentially. What that's doing is it's holding tension there, so when you step and lift the other foot up, it contracts and holds your pelvis stable. Well, think about that. It's holding your pelvis from doing this, and your quadratus lumborum is holding it here to do the same thing. If this is weak, you're more likely to straighten this. If this is overworked. So, what did I do? I ran a 9K, which every single step, this muscle's working to keep the pelvis stable. So it was thunked her down. Then I went to the gym and did squats and deadlifts because I had a powerlifting competition in 3 weeks. Well, that muscle is quite engaged when you're bracing your low back and doing squats and deadlifts. So I had a pretty nasty flare of that one. And this gets back to those overcoming isometrics with the rack pulls. So what I did, in conjunction with a good friend of mine who we're going to be doing some work together, and I will bring him in more soon for you to see, Andrew. He's an accomplished physical therapist, works with some professional athletes in the Baltimore area. I'm not sure how much more I can say just yet. We brainstormed the best way to overcome the problem. And it gets back to those overcoming isometrics. So what I did was rack pulls where I set the deadlift bar heavy, but basically, I keep doing this. Basically, where all I do is stand from here to here. So not putting a ton of tension there. I would also then breathe out beforehand to reduce the expansion of my rib cage and allow my ribs to sit closer to my pelvis. So less tension on that too. So I do those rack pulls, and I would do something similar for squats where I would nice and heavy, stand up, and just stay there. And that gave me the chance to at least engage my core without bending down to a full squat position and putting under a lot more tension. Did that, my back calmed down real fast, and I was able to get to the powerlifting competition where I picked up my loudest and most angry of the injuries of them all. Here's the video. Okay, so it's tough to see exactly what happened there, but I will narrate it through while we're watching this again. The biggest lesson of all of this stuff, poor sleep is one of the most intense and modifiable risk factors for injury. It's not stretching or lack thereof. Bad sleep has been the precursor to several of my most major injuries. Now kind of are similar injuries. So I slept poorly last night. And on the squat today, so in a powerlifting meet, it's squat, bench, then deadlift. So in the squat, I had a great weight, and I tend to go a little deeper because the depth has to be where the crease of your hip goes lower than your knee. And I wasn't sure I was getting there because there's no mirror when you do these meets, understandably. So I said, let's be sure that I'm going nice and deep. So real deep and real slowly. So essentially a nice eccentric contraction on my hamstring tendons. That is a recipe for a pull. The first one went okay, but during warm-ups, I even felt the back of my hamstring pretty much right where it attaches to your, it's called the ischial tuberosity. So your sit bone, right where it attaches there, I already felt a little tender. So I did the first pull, so the first deadlift, and got, I believe it was 455. Felt a little more sore then, but I said, so far so good. This is the last thing of the day. I don't care if I get hurt. Let's do this right. So, back to this one. In my wonderful spandex here, my Captain America shirt, I bent over, picked up the bar, pull, got it up a little bit, pop, pop, pop. 3 pops, back to the thigh. Almost brought tears to my eyes. It was genuinely one of the most disappointing moments of competition I've possibly ever had. Just because I've done better. My heaviest deadlift was 600 pounds. And today I was going to break 1,000 pounds on 2 events. Instead I got 455 and a really nasty pull. Probably not a tear because of it. So what most likely happened is your hamstring is made of a number of muscles. There is the biceps femoris, biceps being 2. So just like this bicep, you have 2 muscles, part of that one. Your semitendinosus, membranosus, and then a bunch of little guys here and there that connect your hip bone to your different parts around your knee. So either they were snapping over each other as they're rolling, or there was just some major strain in there, but I don't think there's a tear. You can tell there wasn't likely a tear because there's no bruising on the back of my thigh. That's a pretty telltale sign of a tear. Without the bruising, I'm confident there wasn't one because I had this exact injury before in the other thigh. What was the commonality there? I did hip thrusts the day before, slept like crap the next night, and then went to do deadlifts because I felt fresh. And same thing, pop, can't walk for a week. So that's why I am in this with this face. Disappointment. All right, so the big takeaways to recap. Number one, you can be a hybrid athlete. This is something that's been of interest of mine for a while. And it kind of makes sense, right? We're not supposed to be super focused on one thing. And it's okay if you are. If you really like one thing, that's fine. But you got to cross train and you got to recover. Recovery is a mix of 3 pillars, more or less. That's going to be nutrition, sleep, and hormonal health. If your testosterone's in the toilet, you're not going to recover as well. If you're sleeping badly, your testosterone's going to be in the toilet, your growth hormone's going to be in the toilet, and you're prone for injury. I was using a medication called sermorelin to help with my sleep and raise growth hormone, thinking that was going to help me recover better in the absence of sleep. It doesn't work that way. That's not how recovery works, unfortunately. Second piece. Hybrid athletes are very incredibly fit people. Look at the CrossFitters. It's become its own sport for good reason. But they need to make that their whole focus, and you need to manage stress, because stress is one of the other major modifiable risk factors for recovery and injury risk. If you're stressed out, your cortisol is going to be really high, and if you've ever known anyone who's taken steroids, they're at risk of a lot of injuries because they have weak soft tissue like tendons. They have worse immune function. Fortunately, knock wood, that's pretty good. And they sleep worse, which gets back to that hormonal stuff and the other parts of non-hormonal sleep restoration of your physical health. So from here, I'm going to get myself ready for something different. I think I'm going to pick one competition and train like crazy for that one. In this case, is it going to redeem myself at a powerlifting show? I actually had more fun running recently. So I'm going to train for a nice race. I'll do a video montage of that training period. I would really appreciate if you could just give it a little like and help other people find this information. We have a lot of other content kind of related to this, of getting people ready for cancer therapies, surgeries, the whole rehabilitation gamut here. Helping those folks find this information will be extra helpful too. There are a lot of commonalities between those training styles. After you get through the prehab purpose, cancer therapy or surgery, what's the really cool stuff you can shoot for next? That's where the performance stuff comes in. So that's why we focus on all that material. We've also put together a lot of really cool free resources here. So different checklists, infographics on different conditions, all that is below. There's a link in the description. Those can take you to a whole menu of options here that we want to just get out there to support folks who are into this information and bring you into our world here, because the whole purpose of Admire Medical, behind me here, the whole purpose of rehabilitation is hope. We'd like to have people realize that even in the midst of a fresh injury or something far worse, aim for something high. Train for something big. Set your goals, and even if your pace is different from someone else's pace, still pursue them and see what's possible. As painful as this was, it's fun to talk about and draw some lessons from it, because you can find some silver linings. It's still kind of worth it.